So doctor, kind of just tell us how we're made. What am I made of? There we go.
Sure. So, you know, the female pelvis is really busy, and there's a lot of structures and anatomy going on.
We're complicated, aren't we?
Definitely. So I'll sort of give you just a broad view of what we're looking at. This is sort of the body cut in half. So if we're looking at the side, this is the uterus here. The cervix, which is the tip of that, and can be seen within the vaginal canal, which is here. This is the ovary, which sits next to the uterus, and the fallopian tube that's there. And you can see how compact the pelvis is, that the bladder, which is here, sits on top of the vagina and next to the uterus, and as well the rectum sits right behind the vagina and the uterus there. So we have a lot of important structures all together within this area. So when you're having treatment on one of the structures, there is a chance that it impacts the surrounding structures.
And we talked about several cancers like uterine, ovarian, cervical cancer. Some of them are a little bit more tricky, like you said. Why so? Because of the location, because of the fallopian tubes that are connected?
It is the location, and oftentimes the need for that combination of treatments. So when you're requiring surgery and radiation, sort of the effect can be spread out to the different organs that are around, and you can see how tightly situated one organ is next to the other. So sometimes, in order to properly treat the cancer, we do have to move other organs out of the way.
All right, and doctor, when having a hysterectomy, I had a partial hysterectomy. I kept my ovaries. Mm-hmm. Does that cause muscles and tissues supporting the pelvic area to drop? Like I've been told, possibly in 10 or 15 years, or maybe even sooner. I might, start,
So there are women who are predisposed to what we call prolapse or a dropped bladder, and mostly it's due to the support structures of the vagina here that are sort of holding up the vagina, the bladder, and the rectum that are there. When the uterus comes out, some of those support structures are removed and taken away, so it may predispose you to some of these symptoms earlier than you would have naturally seen without the hysterectomy.